Healthcare and Medicare in particular were already a minefield of confusion, and the Inflation Reduction Act has only amplified those concerns for users and carers alike. And here to help you navigate the system are Mario Villalpando from Mariocare and Neil Booth from the Medicare Resource Center. Good morning, guys, again. How are you doing?
Good morning.
Good. How are you?
Good. I'm very good. Thank you very much. So last week you were in and you mentioned some changes to Medicare.
Yes.
And long story short, how do you think this is going to affect people, with seniors heading into 2025?
Well, the Inflation Reduction Act has affected many of the plans. One of the big changes are the benefits on the plans have changed. They've been reduced on some plans. Formularies have changed on some of the plans, and even they've added co-pays and some of the tiers have changed on some of these plans. So there's quite a bit of changes because of the Inflation Reduction Act.
Yeah, and one of those things you mentioned with the co-pays, a lot of seniors obviously go and visit the pharmacy on a regular basis to pick up prescriptions or refills. How are they going to be affected next time they go, and what kind of shock are they going to experience when they walk through the doors to pick up their regular prescription in January?
Yeah, this year in particular, or the coming year for 2025, the way that Medicare is doing its prescription drug plans with the Inflation Reduction Act is going to change significantly. There's going to be three main changes. So some of those are going to have a positive effect, so prescription drugs will be reduced, but others may not. One of the things is the coverage gap or donut hole, that's going to be eliminated for 2025. Also, there is going to be a brand new payment plan option as well, where you can spread your costs over the year, which is brand new this year. So that's going to be a really good opportunity. But for others, they are going to have a little bit of surprise if they don't get their plan reviewed, if they don't look into what their plan is going to offer this year. And that's where Mario and we come in at the Resource Center.
Yeah, and another thing, Mario, that I think you briefly touched upon was deductibles being added.
Yes.
How is that going to affect?
So come January 1st, there's going to be a lot of people, if they didn't get their plans reviewed, they're going to be very surprised. So that's where we're asking, just reach out to us, and we'll be able to review the prescription plans. We'll be able to tell as far as if there's going to be any cost, but there are going to be some surprises. There are some plans out there that have added deductibles. And so if you're going to go pick up your prescriptions for the first time in January, and you're used to not paying anything or paying a small copay, you may be in for a surprise. So we're asking, we have this, if you want to email me, I'll send you some more information as far as about the Inflation Reduction Act, and my email is mario@mariocare.com.
Yeah, and how is it, without obviously scaring people watching, and they should be made aware of these changes. How can people best prepare for these changes heading into next year?
Well, they should reach out to us as far as it does not cost to give us a call. It does not cost to talk to us about your prescriptions. We're here to help you make sure that you're not surprised in January.
Mm-hmm. Yeah, I mean, there's going to be a mountain of changes, and quite honestly, even from my point of view, like looking through some of this is confusing, and I'm not one who's taken up the plan. So, are there any words of advice you can share with viewers out there? I mean, apart from obviously giving you a call, because one of the beauties of your service that you mentioned, it's free, and you can walk them through the whole steps, right? That enrollment, everything, all kind of choosing plans to fruition. You are there every step of the way for them.
Yes, yes, we sure are. So, yeah.
Yeah, I think one of the main things is each individual gets a notice of change every year. Just be aware of what you're getting sent in your mail. Open your mail, read it. If you have any questions, reach out to a local licensed agent, somebody that knows Las Vegas. They know the plans. They know what the changes are going to be. There's some great stuff happening. In fact, part of it is the lowering of the catastrophic stage. So that used to be $8,000. That's going down to $2,000. So those seniors that have a lot of prescription drugs may actually benefit. So it's not all bad news, but you want to know, you've got to be informed. And again, that's where we can support and help the community here and our seniors. Yeah,
one of the things, like you said, is keep it local. And the other thing, of course, is to call you. Free service, just give you a call.
Exactly, exactly. We have a local office here on Eastern and Tropicana, the Medicare Resource Center. Stop on by or give me a call or email me or go online, Mariocare.com.
That's cool. Neil, Mario, thank you so much, guys. Mariocare is a free service helping walk you through the various plans all the way to enrollment. And to take advantage of this free service, just visit Mariocare.com and be sure to check their upcoming events section too.